welcome from Allengers Medical System Limited. Uh, Today, the topic which assigned to Allengers, that is a problem what to do when CM stop during a surgery, sir. So I have noted down, if the CM stopped during surgery, it is a very stressful situation in the OT, sir. Everybody panicking because the condition is very different. So initially we see that that few problem which we are routinely facing in there in during surgery. First of that, sir, that is a KV fault, filament fault, exposure not completed, image not coming on display, that your vertical up and down movements problems is came in there, display monitor not working, exposure hand switch not working, and exposure foot switch even not working, workstation lagging, and sir workstation restart intermittently. So we correlate that, sir, these are the fault normally seen on there your C carriage display, sir. This is a KV fault interlock when your generator or any power supply related issue is came there. So that error is came in there, sir, display. Second thing, that is a tube filament error, sir. Is it is related to mostly of the time of tube, sir. Third is their exposure not completed or image not coming on there. That is in between, that thermal interlock is coming when the surgery is longer than as comparatively other. So tube is maybe heated. So at that time the thermal interlock is came there. So there few suggestion, or at the time of during surgery, if the problem is came there, sir, so we analyze that the few fuses on the machine is there, sir, available. If you see that, sir, that is the fuse number 2 and fuse number 3 is there, sir, the same in there. If problem is persist, kv filaments and filament faults and exposure not completed. So firstly we go and check this fuses, sir. If this fuse is okay, then we go for that their emergency exposure switch is available, that, sir, which is bypass the few circuitry, and at least you can complete that your surgeries in there, sir. And after that, sir, there few problems notice that the tube basically cm vertical movement is stuck out that. So in their machine there one fuse is available, that is clearly mentioning there up and down. It is a near about 6 ampere. If initially you face that, you can check that at the time is there, sir. So and replace it and try to work out that, sir. And the another problem is display not working. Somehow cases their cable is loose that, or uh, uh, in between the shifting the machine one OT to second OT, the connection may be loose. So firstly we check that either it is a loose connector, then refix that. And sir, third thing is there, exposure hand switch related issue is there, and exposure foot switch related issues is there. So both connector is available on the machine, and it is reconnect the units and try to go for next, sir. And that one is a workstation lagging. Sometime it is a restart. Sometime it is unit is hang in there. That is the layman language. So we restart the unit or check that any loose connection is there, or the one problem is majorly facing that sometime workstation restart intermittently. So that is related to basically power supply in between the unit and main supply. So we go for and check that power cord, sir, initially. Then after, if this problem is same persist that, so we call that next for service engineers. So they will be help that, sir. Thank you, sir.
Very crisp talk, Mr. Kanojia.
Yes,
And
sir.
really, we face lot of difficulties when the Siam gets off.
Yes, sir. Yes, sir. Yes, sir. So
We,
majorly, initially, what we services we can provide that on the emergency time, that we are noted then and present to you, sir. So that is really helpful to other initially during the surgery, because that is a very uh, stressful situation in there.
yeah,
When they
sometimes we as an orthopedic surgeon do get stuck, and the
uh,
Siam is not working. So your
and
crisp talk will help us.
yeah, the one more suggestion is there, sir, when the CM is not there. So earlier the try to go that that is a mobile X-ray or fixed X-ray, but right now that is a time for a mobile DR. If if they if the problem is persist that, and if nobody can emergency support is there, so they can go for that that is a mobile DR, and they will we complete that surgery.
So do we have the mobile DR in the same machine, or you have to have it in a different setup? How do we look into it?
No, actually, normally, if you see that, sir, normally in orthopedician, they have that X-ray machines and all
Yeah,
these things.
yeah, we do have that.
Yeah, you do have that. And
Mm.
if uh, in few cases, na, if you have a retrofit kit, sir, so so there one tab is also provided by the few companies, sir. So you go and try to that. So at that same time, you can initially within a 4 to 5 seconds, you can take the images and complete this at least.
Oh, great.